Good morning, everyone. I'd like to thank you for joining us today for the Missouri Medicaid State Plan webinar. We have Shelley Summers with the Federal Programs Unit that will be presenting today's information. We encourage you to submit any questions that you may have during the webinar via the Q&A box. Those will not be answered in real time. However, they will be compiled into a Q&A document and be posted along with a recording of this webinar. So if you have any technical questions in regards to sound or things like that as the webinar goes on, you can drop those questions in the chat box and I will do my best to address those. So without any further ado, I will turn it over to Shelley.
Hi, everyone. As Heike mentioned, my name is Shelley Summers, and I work in the Federal Programs Unit here at Central Office. So today, we are going to review what is HealthNet. We are also going to look at what are the delivery systems. We're going to look at program and covered services, which include durable medical equipment, transportation, personal care and long-term care, and then Healthy Children and Youth Program. The Medicaid exceptions process overview, we'll take a look at that also, and then the 1915C home and community-based waivers. So what is HealthNet? Medicaid, which we refer to interchangeably HealthNet and Medicaid, but it is a federal and state program that covers qualified medical expenses for those who are determined to be eligible. Eligible individuals receive a HealthNet identification card or a letter from the Family Support Division identifying them as eligible for certain medical care services. The Medicaid program is authorized through Title 19 of the Federal Social Security Act of 1965. Medicaid and the Children's Health Insurance Program, which is referred to as CHIP, provides public health insurance coverage to over 73 million Americans. The federal government offers matching funds to states to support the financing of Medicaid. Missouri Foundation for Health offered some 2018 statistics, and I thought they were pretty interesting just to go over a few of those. So like I said, Missouri Medicaid, which is referred to as HealthNet in Missouri, is a state program that covers qualified medical expenses for those who are determined to be eligible. So here's just a few facts. Medicaid covers 1 out of every 6 Missourians. It covers 44% of Missouri's children. It covers 1 out of every 13 seniors over the age of 65. And it also pays for 65% of all nursing home care. And currently, Missouri provides access to medical treatment for over 976 Missourians. So that just gives you a few facts of about Medicaid here in Missouri. So the Medicaid delivery system are fee-for-service and managed care. Fee-for-service provides medical services for those who participate in the HealthNet program and agree to accept the HealthNet payment as reimbursement in full for any services provided to HealthNet participants. Managed care organizations, MCOs, they offer services through the HealthNet Managed Care Program and are provided in accordance with the terms and conditions of the contract between HealthNet and the managed care companies. In 2017, Medicaid managed care programs went statewide. However, Missourians who are aged, blind, or disabled, including those Missourians with developmental disabilities, served through the Missouri Department of Mental Health, were not included in the managed care system, and they continue to receive services through the fee-for-service HealthNet program. And there again, a few stats. Approximately 30% of Missouri's total budget was dedicated to HealthNet, and 51% of the state's Medicaid funding does come from that federal funds, FMAP. Increases in program costs have a majority impact over the overall fiscal conditions of the state. So as you can see, Medicaid does, it has a hefty budget. So also, just for a resource, there are 144 Family Support Division resource centers. They are located throughout Missouri, and at the end, there will be a resource page that does have that information listed on it. So Missouri HealthNet covers services that fall into two categories. There's mandatory and then there's optional. Mandatory services are required by the federal government for all states wishing to have a Medicaid program. Then the optional service may be provided at the state's direct discretion. The HealthNet benefits table shows a variety of benefits for each of the programs, and if they have a cost sharing or any co-pays, and that resource will also be at the end of the PowerPoint too. So just to cover, there are a few covered services that we highlight, and the state plan covers a variety of services, medical equipment, supplies for both children and adults. DME, durable medical equipment, and non-emergency medical transportation programs are highlighted because the Division of DD's own community-based waivers have specialized medical equipment that's very similar to DME. We also have personal assistance and transportation, which are services that cannot be supplanted through the state plan services. So for example, of DME are like oxygen, wheelchairs, walkers, and other items your doctor's orders that are medically necessary. And then we've got non-emergency medical transportation programs, which may use public transportation, bus tokens, vans, taxis, ambulances, if necessary to get you to your healthcare appointments. You may also get help with gas costs if you have a car, have a friend or a neighbor that could help you out with that. HealthNet does not cover everything, and there are many types of eligibility within HealthNet. The participant handbook explains the services you can get and to find out what you're eligible for. You can call that number at 1-800-392-2161. Some eligibility types have more benefits than others, and some services are not all covered for participants. So a few of those options are dental, optical, audio, some durable medical equipment, rehab services, and the list goes on. So you can check those out in the participant handbook. So state plan personal care. Personal care services are generally medically oriented tasks provided as an alternative to nursing facility care, and they are designed to meet the maintenance needs of an individual's chronic health conditions. It is a CMS requirement that Medicaid state plan services are exhausted prior to accessing a comparable service with the HCBS waiver programs. Personal care versus personal assistance. State plan personal care includes agency-based and consumer-directed services. Medicaid participants who receive those only, as Medicaid participants can receive services through only Medicaid home and community-based services at a time, so regardless of the state agency administering those waivers. So state plan personal care services may include any of the following tasks. So we have dietary, that's with assistance with meal preparation, cleanup, assistance with feeding and eating. You've got dressing and grooming, So that would be assistance with dressing, grooming, which would include combing hair, nail care, oral hygiene, dental care, shaving, bathing. That's assistance with bathing. Of course, it includes shampooing one's hair. Toileting, that's assistance with going to the bathroom, changing bed linen. May also include the changing the bed linens for participants with medically related limitations that prohibit the completion of this task. And mobility and transfer to the bathroom should be included and delivered as needed with the service. Mobility and transfer. That is the assistance with transfer and ambulation when a participant can at least partially bear their own weight. Actually, lifting the participant is not an appropriate task under the service. And just to make note, administration of medication is not a covered task with personal care programs. The self-administration of medication tasks does not include the amount of time required by the facility staff to administer any medication. Okay, slide 9. That is just, we're going to talk about state plan personal care eligibility. So that, to be eligible for state plan personal care, the following criteria needs to be met. Of course, you've got to be Medicaid eligible. You must be assessed at the nursing home level of care. And of course, you need to be in need of a personal care service. Also be assessed at meeting 2 medical criteria to receive attendant care. Additionally, the participant must be maintained safely in their home environment by a coordinated set of services mutually established with the client, or I should say participant. And they must be receiving services at a cost equivalent to or less than the cost of a nursing home care, and actively participate in an approved plan of care to promote the highest health-related quality of life. So self-directed or consumer-directed personal care is only for those participants who are at least 18 years old and who have the ability to self-direct their own personal care services. They may qualify for state plan consumer-directed services. So participants authorized for following services through DD are not eligible to receive state plan personal care through DSDS. And these are the 3 that are not eligible. If they're receiving shared living services, residential habilitation, which is our group homes, and of course the individual supportive living arrangements. So those are the 3 that you can't, the participants are not allowed to be eligible for state plan personal care. Healthy Children and Youth Programs. So this is the Early Periodic Screening, Diagnostic, and Treatment Program, EPSDT, which was renamed, which I'm so glad, to the Healthy Children and Youth Program. The HYC program provides those services for eligible children and youth from age 0 to 20. Diagnosis and treatment services have previously been available to HealthNet eligible children under the EPSDT program. However, treatment services were limited to those covered under the HealthNet Medicaid state plan. HYC provides all HealthNet eligibility children with appropriate full health screens, subsequent treatment for identifying health problems. Components of a full health screens include interval histories, physical examinations, guidance, laboratory tests, immunizations, blood screenings, development, personal, social, and language, fine, gross motor, hearing, vision, and dental. A full screening may be provided by a HealthNet enrolled physician, nurse practitioner, or nurse midwife when it is within their scope of their practice. Partial and inter-periodic screenings are available from a wide range of healthcare providers. So I'm not going to go through the entire list of what HCY covers, but they're on the PowerPoint there. But if a service or services are available to children under state plan or HCY, it may not be covered through the waiver. There are services which can be provided in the waiver that serves children, such as respite, and not duplicate what's in the HCY program. Now, in the MoKids waiver, and that's the waiver that just serves children under 18, it does have similar services in HYC, but they can, similar services in HYC cannot be furnished in that waiver. So we do have listed out in MoKids OT, PT, and speech therapy. If a waiver covers both children and adults, any waiver service that could be furnished in accordance with the 1915R of the Social Security Act shall be limited to adults because comparable services are available for children in the HCY program. So long-term care has some personal care services. With Medicaid facility-based care, facility-based nursing care covers services provided in certain residential settings and accounts for one of the largest portions of HealthNet costs. Medicaid also covers personal care residential facilities for eligible people with DD, including ID. But we just want to be sure it's understood. HealthNet does not pay for the cost of the stay in the residential care facility or RCF. They only reimburse the personal care services in the RCF. Personal care services are maintenance services provided to the residents of the RCF or ALF to assist with those activities of daily living. Services are authorized to those eligible participants when the need of the resident exceeds the minimum obligation of the facility as established in the license requirements. So that's a lot of information there, but it's important about state plan personal care. So then we have the Medicaid community-based care, and that is community-based care in Missouri's HealthNet programs that supports a number of HCBS waivers that allow certain consumers to receive care in their home or in the community rather than in a nursing facility or an institution. So how do we tell if a specific HealthNet procedure is covered? The best way to know if a specific procedure is covered is getting the 5-digit procedure code from your healthcare provider and making that call to the HealthNet Participant Service Unit, which is at 1-800-392-2161. They can tell you if the procedure is covered and if there are any special rules and, any special rules about that procedure. HealthNet Division may provide coverage through some exceptions process. So we will jump to slide 15. So like I said, the HealthNet Division may provide coverage through some exceptions process for services that are not typically covered by HealthNet. So the participant's physician may request coverage for an item or service under certain conditions of unusual or compelling need. The item or service which exceeds that normal HealthNet benefit must be needed to sustain that participant's life, improve the quality of their life for the terminally ill, replace an item due to the active nature, or be needed to prevent a higher level of care. Services for individuals under 21, which are identified as a result of an HCY screening, and are determined to be medically necessary are covered under the HTY program. And I know with the exceptions processes, there can be a lot of confusion with that. So, you know, just making sure you the healthcare provider contacts that HealthNet participant service line or the provider line can take out a lot of steps with that process. So with the exceptions request, there are two categories. There's emergency and non-emergency, which are processed differently. Non-emergency exceptions request forms, so there's actually exception request forms that must be signed by the treating prescriber of an eligible participant before being submitted. Upon receipt of that request, HealthNet processes the request within 15 state business working days. We know sometimes it seems like it goes a lot longer than 15 days, but that's what their process is limited to, is those 15 days. The exceptions unit then obtains a decision from the appropriate medical or pharmaceutical consultant, administrative official, and they will inform the treating prescriber, the provider of the service, and the participants of the approved decision. Notifications letters will be sent. If approval is given, the letters will inform the treating prescriber, the provider of service, and the participants of all approved decisions. In the event that there is a denial, the prescriber or participant will be notified. So an emergency, if there's an emergency exceptions request. When a prescriber determines the participant cannot wait those 15 working days for the non-emergency request, and the request meets the criteria of life-threatening, the exception review will be completed within 24 hours. And that request should be phoned by the authorized prescriber, and we got the number listed there, 800-392-8030, and it's an option 2 button. So to go over a little bit about the Medicaid home and community-based waivers, there's sections 1115 and 1915 of the Social Security Act define specific circumstances in which the federal government may, at the request of the state, waive certain provisions of these federal laws. So the waiver is an agreement between the federal government and the state that exempts the state from the provisions of the federal law that were waived. The waiver includes special terms and conditions that define the strict circumstances under which and for whom the state is exempt from the provisions of that state law. Missouri currently has 10 1915C HCBS waivers, and I think in 1915B waivers authorized a managed care system. So, and I think there may be one 1115 waiver, and that's through DHSS and DMH. So here's just a list of the waivers, and we all should be pretty familiar with those, so I'll just go through them real quick. Division of DD has the MOKIDS waiver, which is the Missouri Children's with Developmental Disabilities waiver. We have the comprehensive waiver, which is primarily for residential, community support waiver, and then the partnership for waiver. And then, of course, DHSS includes the adult daycare waiver, aged and disabled. They have an AIDS waiver, a brain injury waiver, which is fairly new, independent living waiver, and then the medical fragile adult waiver. So just a little bit about some HealthNet State Plan and DD waiver services. So CMS requires that any service available in state plan that can meet the individual's assessed needs shall first be assessed and exhausted prior to providing HCBS waiver services. CMS instructions, which is a technical guide and review criteria for the 1915C waiver, states that waiver services shall not duplicate state plan services. However, 1915C waivers may supplant state plan services, surpass amount, intensity, or duration, which is an extended state plan service. And then they also have complementary state plan services, which are waiver services that cannot be covered under state plan. And then here's the resource page I mentioned earlier. It's got the benefits table, more about the exceptions process, because really what we're doing here with this webinar is just giving a kind of a high-level overview. So there are resources out there. If there's, or if you have questions, like I mentioned earlier, we can kind of compile those together and make sure we have those available and posted on the website. But here's links for fee-for-service, managed care, personal care manual. And if there's any other resources that we could add or would be beneficial that we can offer, please let us know. I think I tried to add all the resources that were attached to the information that has been put forth with the webinar. So here's some more. There's the personal care policy, the FSD resource centers. That gives you all the maps and locations of their the centers. There's the limits, units, and rates. That's some of their services that are available through DSDS. Those stats and different things that I've listed out there, so Missouri Medicaid Basics, and then, of course, the non-emergency medical transportation link there. So there's other resources you think that might be helpful to others, please let us know. We should be happy to post those too. So with that said, that's the overview of the state plan webinar. I appreciate everyone being available to listen in since we had to reschedule. If there's anything else, like I said, please send forth the questions or any comments so we know what we need to do for next time. I think that's all.
Great. And as mentioned, we will be posting a recording of this webinar as well as a Q&A/FAQ type document that captures the questions that were received and the responses, as well as the presentation. So that will be on our DD website, and there will be an email blast that is sent out when that becomes available. So thank you, everyone, for joining.
Yes, thank you all.